Namaste. I am Dr. Hemlata from Indian Institute for Skill Development and Employment Training. Today I am here to explain you the importance of apprenticeship training in nursing. So first let us understand what do you mean by apprenticeship. So apprenticeship is the training which one takes in the industry under the hands of a master, and this industry may be any industry where he or she wishes to join as an employee. Now let us understand what do you mean by apprenticeship. Apprenticeship is the practical training which one takes in the industry. So this may be of two types, that is paid internship or unpaid. So unpaid apprenticeship is the one where the candidate learns the work while he is in the industry itself, but he is not getting paid for it. And the other one is paid apprenticeship, where you get the benefit of payment along with the work which you are doing. So paid apprenticeship, in other words, can be called as learn while you earn also. So these are the two basic fundas of apprenticeship, that is paid and unpaid. Now you will ask me, what is the importance of apprenticeship? So looking at the scenario nowadays, whenever a candidate goes for an interview, the first question asked by the employer is what experience you have, and here lies the answer for the apprenticeship, because as a fresher no one is interested to hire the candidates, and if no one is hiring the fresh candidates, then from where he will gain the experience? So this apprenticeship came into picture. This is the practical training which one gets while he is completing his or her course, and then this candidate can proudly say that he has some experience, and even while hiring the candidate, the employer is satisfied that at least he is not hiring a fresh candidate, but he is hiring a candidate who has some basic information or basic knowledge of the job which he is going to do. Now you will ask me, is there apprenticeship training in nursing sector? Yes, of course there is. So there is a module known as JNM assistant course, which comes under Apprenticeship Act under non-NAPS in optional trade. So here the scenario is that this is a one-year course which is specially tailor-made according to the demand of the industry. That is, this course consists of the content which is as per the industry demand. Here there are two components associated with it. That is, one is practical component and the other is theoretical component. So here there is a 3 months of theoretical component where the candidate learns the basic things or basic nomenclature about the nursing sector, like how to take the BP, what is the full form of BP, that is blood pressure, then what is hypertension, what is hypotension, how to take the temperature, what is TPR, how to give orders, how to take order, how to wash up in notice, and all the basic things which are required for a candidate to be a basic nurse. And then after completing this 3 months of theoretical training, the candidate goes for a practical training in the hospitals where he is assigned. Now the hospitals keep them as a trainee apprenticeship. Here they learn on job, like they are learning on the patients itself, because see, if you want to inject the injection, you have to inject it in humans only, then only you can realize the pain or the procedure, how we inject the injection in that body. Even if you try it on 100 times on a potato or a doll, what's the use? Tell me. Because potato doesn't have pain, doll doesn't have pain, so even if you inject it anyway, it is going to prick the person, prick the instrument or prick the potato. But since it doesn't have any feeling, whatever you are doing, it is correct or wrong, you are not able to understand. But if we inject it in a humans, then you will know that how the baby shakes while giving the injection, or the pain which patient is having. So you will be careful in doing that. It is exactly same as, like suppose if I tell you mango is sweet, so and if I close your eyes and I put sugar in your mouth, so you will imagine this is sweet. So is it mango? No, you have to first taste what is mango, then only you can tell me the difference between a sugar and a mango. It is same, like what whatever experience you gain while doing on-job training or practicals, that is more important than the theoretical things. So in nursing, I think apprenticeship is the most important or the basic fund of nursing. Without apprenticeship, you cannot become a good nurse. And now government has introduced a course known as GNM assistant course in optional trade under non-NAP scheme, under Ministry of Skill Development and Entrepreneurship, under healthcare sector. And here you can become a nurse having qualified as apprenticeship nurse. Now you will ask me, where can I go for this course? So the answer is quite easy. IISDET is the only institute which is offering you GNM assistant course, and IISDET is spread throughout India. So in most of the district places you can find a center of IISDET. Now for this GNM assistant course, for the theoretical component, the assessing agency, that is assessment agency, is Indian Institute for Skill Development and Entrepreneurship. The Skill Development and Indian Institute for Skill Development and Employment Training. And for the practical purpose, the assessment agency is Ayush Multi-Speciality Hospital. So remember dear, if you want to go for a nursing career and if you choose the stream to be apprenticeship stream, then IISDET is the correct place where you are landing up. So remember, join IISDET to complete your career as a GNM assistant. Thank you.